From the KDLM studios, it's time for Hodge Podge, presented by Partnership for Health and airing on Lakes TV3.
Welcome back into Hodge Podge on this Monday, November 16th. I'm Joel Kepke. Our segment number 2 today, Katie Lundmark joins us via our Zoom studios from Ecumen. Katie, good morning. Thanks for being with us today on Hodge Podge.
Good morning. Thank you so much for having me.
Oh, there we go. Let's try that again. Okay. It helps if I have the right buttons pushed for you. So,
all right. Good morning.
Yeah, it's good to have you with us. Katie, during the pandemic, a lot of questions. First off, let's just talk a little bit about what folks can do as our numbers around the area continue to rise. First off, I want to talk about masks. Some people are in favor of them, some aren't in favor of them, but the reality of it is whether you or you don't think you have it, mask is just a really good way to help prevent the spread of COVID-19.
Absolutely, it is. And so much of what we have talked about and heard about over the last 9 months is what mask wearing. And now that the virus is really here in our area, it's so much more also about what do I do if I feel sick? What can I do to prevent myself from getting to that point of feeling sick? And that's the real struggle that we're faced with right now.
Katie, when we talk about, let's just run a scenario. So I wake up tomorrow and I got a little sore throat and I'm a little congested and I go, I don't know if I should go get a test, but in the interest of public safety, I do. Now you're looking at 3 to 5 days before those results come back. Let's just talk about protocols for people that think they maybe aren't feeling well. When should people decide to go get a test?
Yeah, any of those symptoms that you just described are exactly what would be a part of getting tests on. I am not a medical professional, but just working with the Department of Health on a daily basis, so much of what they've talked about is quarantining if you don't feel well, staying home, not being around friends or family, not being out in the public. That's a really important piece of this puzzle. And it's hard. What does this look like? We are human beings. We want to be social and we want to get back to normal. Everybody wants to get back to normal. So what does that mean to go get a test? If you know that you were exposed to someone, most likely your healthcare provider will allow a test to happen. If you were not necessarily exposed or knowingly exposed, it's still the right thing to do to quarantine yourself and isolate yourself in your home setting while you wait and see.
Katie, there's some question about the cost of these tests and who is responsible. Does it fall on the provider? Does it fall back to the individual if their insurance? What can you tell us about what the cost is for these tests?
Oh boy, that's a big question. Insurances are all different. I would not say no that the hospital or the clinic system, that's something you would call your clinic up and walk through with them.
So let's say I go in and get that test and I'm waiting for the results to come back. If you feel good, I think there's that tendency to go, you know what, I feel okay. I'll just wait till the test results come back. But in the interim, you could be positive, even though you feel 100% healthy, correct? Absolutely.
And that's where we're seeing so many cases move throughout our communities is because we feel okay. We're asymptomatic carriers. We are spreading the virus unknowingly. So that's a really big piece of this puzzle, that to get it under control, we have to take different measures than what we would in a normal situation of not feeling well. We need to wait for those test results to come back. It's just what we have to do right now to try and manage this virus.
When the pandemic started last March, we went through that initial period, then we get into summer, and our numbers in outstate Minnesota were fairly low. Yep. Now the summer's come, and now we're into fall, and now we're seeing the Becker County and Otter Tail County numbers around us continuing to rise, which has had an impact not only on businesses, but on schools and everybody throughout the area. For those who, and I don't want to say they haven't taken it seriously, but is maybe this a wake-up call for the general public, Katie, that we have to take this seriously to prevent the spread of COVID-19?
Yeah, that is such a big part of what you're hearing on all media right now is the growing numbers. And although there's a lot of different opinions about it, what the end result is that we have hospital and clinic and healthcare senior services settings with employees that are beyond the point of what they normally work at. The hospitals are full, and yep, they're COVID positive residents or patients in those hospitals, but there's also so many other people that need healthcare. And so when we're full in those healthcare settings and there's not enough staff to take care of everybody with this added pressure of COVID-19, it's a real issue. And from the senior care sector, all the way to the clinics, all the way to our hospitals, all of these people have been working in a really, really tough environment for 9 months plus. I can't believe we're at a 9 months plus window. It's just unbelievable. And so I hope that just understanding that piece of the puzzle, it really will affect maybe you if you don't get COVID, but maybe you get in a small car accident, and then what? You have to go in, and it just is not the type of healthcare that we as healthcare providers and communities want to be able to give. We are just strapped. That's the bottom line.
And, I think strapped is a great way to describe that, Katie, because, well, one thing we don't see or hear a lot about is the impact this has had on our healthcare professionals. Whether you're in a nursing facility, you're a CNA, you're a nurse at the hospital, whatever the case may be, these people are exposed to this almost on a daily basis. And when they get taken out of the work pool, so to speak, for their time, that puts pressure on everybody else to try and pick up the slack.
Yeah, you nailed it. And, so much more, has been talking about, well, I still want to see my family. And it was such a notable quote that I heard last week about the holidays. And I heard someone state, the holidays aren't canceled, but they are paused right now. And so what does that mean for your family? You have all these traditions that you have been a part of for so long and so many years that you've done with your friends or your family. And what does that mean if I always take a shopping trip with my sisters and my sister-in-laws? Or how does that look different? And there's ways we can combat that. There's ways that you can still balance that out. So wearing a mask when you're out in public, if you decide to do the shopping event, but maybe you don't ride together in the same car, because that's when those unknowingly pieces of, a couple of days later, I find out I don't feel well and I have COVID, and you then spread it to 4 other people or whatever the case is. So how can you look at your family events and whatnot in a different way?
I think as a general public, we drive by the hospital here in DL or in Perm or wherever your community is, and you look at the size of these facilities and go, oh, they got plenty of space. They've got plenty of beds for people. But the reality of it is that when you look inside of those hospitals, the vast majority of those rooms are not designed for ICU type stays for people who desperately need to get into a hospital.
Mm-hmm. Yeah, we have just seen so many different challenges this year. It's the staff in our communities that we continue to work through different levels of resilience that we all are finding we have. We didn't know we had. We have stress levels that are so high right now. This is a hard time on every single person that is in the world right now. This is just a real struggle. So providing everyone with additional grace, providing all of our healthcare workers that recognition that yes, we have been doing this for a long time. That's just a really big piece of this. It's tough. It's hard. And so, my plea to the public is stay home if you don't feel well. Make different plans for your holiday gatherings. Use technology. There are things you can do outside still that are fun and still a family activity. The skating or go to a park and take a walk. We have plenty of beauty here in our country, and it's cold, so we dress for it. We're Minnesotans. We know how to do that.
Katie, you talked about working with the Minnesota Department of Health, and back in the early part of summer, they kind of predicted this as we get into fall and the winter months that we would unfortunately probably see a rise and a spike in the COVID-19 numbers. And the health department certainly statewide is trying to do what they can to help curtail these numbers. When you look at the daily numbers, or do you look at the daily numbers, Katie, before I ask, do you?
I do, yeah.
And, for somebody like you see these on a daily basis. You see those case numbers go up, and you talk about the stress level. How frustrating when you see these numbers rise and know that deep down outside of what you can do personally, there really isn't much else that we can do except try and prevent the spread of COVID-19.
Yeah. And we're doing so many great things. Our community is is doing that. It's when we decide to do those small indoor gatherings. You can see the correlation from when the cold weather hit in our area is really a really strong case to being able to see exactly when our COVID numbers started to increase in our communities, because we're making choices to be inside instead of outside. And so, this is the time. If there was any better time, now is the time to make a plan to not gather indoors. That's so much of what we hear about from the Department of Health. And that is the scenario we are in right now. It just truly is.
Katie, before I let you run here this morning, is there anything else you'd like the public to be aware of?
No, I just thank everyone for their support. This has impacted everybody. We ask you all remain safe. We work together, as long as we continue to work together to stop this relentless spread of COVID-19, we have to do it all together. And I know that we can, if we all agree to one thing, and that's social distance and wearing a mask and making those choices now with the holidays.
Katie, great information to give out to the public today. We appreciate your time with us here on Hodge Podge. Katie Lundmark from Ecumen, have a great day, and thanks for being with us this morning.
Thank you.
All right. Again, Katie Lundmark with us today from Ecumen. And again, if you'd like more information, you can catch the podcast, or I'm sure. Katie, are you still there?
I am.
I forgot to ask you about a phone number or contact information. If folks would like to get in touch with you, how can they do so?
Sure. They can call me at 218-850-0008.
All right. Thanks so much.